Let's talk about venous thromboembolism. So venous thromboembolism is derived from vein. So the veins are the blood vessels that return blood back to the heart. Thromboembolism means blood clot formation inside those veins. Now, in the body, there's a very strict balance between bleeding and blood clot formation, so that you are at the center where you're not bleeding and you're not making blood clots. In the body, there are natural anticoagulants which are found inside your blood. The work of these natural anticoagulants is to maintain a balance to make sure that your blood does not clot. Some people, unfortunately, are born with deficiencies from these. They don't have enough of these natural anticoagulants, these preventers of blood clot. And so when they have a deficiency, it means that their blood is thicker than usual and it is prone to clot formation. And we call these people having a thrombophilic condition, meaning your blood is prone to making blood clots. Now, the biggest problem with venous thromboembolism, and it's just another name for deep venous thrombosis. You can also have superficial thrombosis, but we'll focus today on deep venous thrombosis. So deep venous thrombosis means that the veins deep inside your lower limb, clots, the veins inside there accumulate blood clots, yeah? And then the biggest problem with these venous thrombosis is the fact that apart from causing pain and discomfort on the lower legs, those blood clots can travel because blood must go back to the right side of the heart, must go back to the right ventricle, and then from the right ventricle, it goes through the pulmonary artery, which is the artery connecting the right ventricle into the lungs for oxygenation. So these blood clots can travel from your legs to the right side of the heart, and then now they get trapped in the pulmonary artery, and so it makes it difficult for the heart to oxygenate blood because pressure builds up in that pulmonary artery, because the right side of the heart will be struggling, so it has to increase the pressure in order to push blood through those blood clots into the lungs. And so pressure, and then patients start to become sick. You feel like shortness of breath because blood is not getting oxygenated properly. And then you can start to just feel lightheaded. Some people will faint. Some people will get chest pain. And when you evaluate them, usually if you do an echocardiogram, you'll see that the right side of the heart is becoming big in what is called right ventricular strain. You see a pattern called RV strain on echocardiogram and even on ECG. So what causes venous thromboembolism? So there's something called Vascular triad. So Vascular triad means that any of the three, an abnormality either on the three areas can lead to venous thromboembolism. So on Vascular triad, one of the factors is injury to the veins. You can get injury to the veins. Maybe there's trauma, maybe you get a fracture on the lower leg. Your vessel can end up getting injured. The second thing is venous stasis. Stasis means, like blood is standing, this poor circulation. Venous stasis can come like if you go on a very long journey, or if you're bedridden for some reason and your muscles become weak, so the circulation won't be happening, and so blood just stays without flowing on, just lingers around, because blood is supposed to just circulate continuously. But if blood is just pooling around, that's called venous stasis. And then the other factor is when your blood is thicker than usual, it is prone to clotting in a condition called a hypercoagulant state. So hypercoagulant state is when your blood is thicker. One of the causes of hypercoagulant state is if you're lacking these natural blood thinners. The natural blood thinners are called protein C, some of them protein C, protein S, antithrombin 3. Some people have abnormal proteins called factor 5 laden. Or if you have an autoimmune disease, then your veins will be so inflamed. Like if you have rheumatoid arthritis, or you have lupus, or another connective tissue disease, can lead to venous thromboembolism. So usually, for patients who are getting pulmonary embolism, because it's just under one umbrella, 50% of them will be having a DVT, a symptomatic one. There's a deep venous thrombosis, but there are no symptoms. But for patients who we diagnose with pulmonary embolism, because the presentation can just be shortness of breath, chest pain, or a patient has collapsed, and then you do CT pulmonary angiogram and you diagnose pulmonary embolism. We don't always go looking for the deep venous thrombosis because it will not help. It will not change management. This is someone you'll still need to anticoagulate for similar duration of time. So we don't go looking for a DVT. However, if you come in with pain on the legs, it's usually one leg, and then that one leg could be more swollen, bigger than the other leg. Then our suspicion for deep venous thrombosis will be high, and then we will do what is called Doppler ultrasound. Doppler ultrasound will check if there is blood clot inside. So there's a difference between venous insufficiency in what is called varicose veins and deep venous thrombosis. Those are two different things. And venous insufficiency or varicose veins doesn't predispose you to deep venous thrombosis. So those are different. Even the way you treat are totally different, yeah? So usually if we diagnose you with pulmonary embolism or deep venous thrombosis, we have to try and look for what predisposed you to that in the first place. So we'll ask you for, as I said, for people who maybe got an injury, maybe were involved in a road traffic accident, they had a fracture on the leg, they can get a venous thrombosis, and that will be called a provoked. It will be called provoked because something was provoking it. For unprovoked, you really can't tell what caused it, but we try to investigate around it. So we will send you to do age-appropriate cancer screening if we diagnose you with venous thromboembolism, either pulmonary embolism or DVT. So like for women, breast cancer screening, cancer of the cervix screening, prostate cancer screening, just age-appropriate cancer screening, yeah? Your doctor knows what age-appropriate, like if you're 20 years or if you're 30 years, the way I screen you for cancer is different than from someone who's 70 years old. And then I will also do what is called, thrombophilia workup. We will order for ANA, which is to check for any autoimmune diseases. And then we'll check for the clotting factors. We just want to see how much you have. So there are those commonest ones like protein C, protein S deficiency, antithrombin 3, factor 5 laden. Basically, maybe I've forgotten others, but we just try to screen you for the commonest ones. If the reason we screen is to help us know how long we will treat you. So most of the patients with venous thromboembolism, either PE or DVT, will be treated for 3 months. A few of them will be treated for 6 months. Others will need lifelong anticoagulation. So for example, if you get a DVT or a PE, and then we discover that maybe you have protein C or protein S deficiency, or your ANA is positive, then you might need, or if we diagnose you with cancer, then you will need lifelong anticoagulation. And this is because if we stop the blood thinners, you can get another pulmonary embolism, and we don't want that happening. So your doctor will tell you if you need to be treated for 3 months, for 6 months, or lifelong. It just depends on how you present. The blood thinners will prevent your body from making more blood clots, but the blood clots you already